Welcome to our session today. I'm Dr. Jane Houston, the Clinical Director of Midwifery and Women's Health at Frontier Nursing University, and it is my honour today to introduce Susan Stone, Doctor of Nursing Science, Certified Nurse Midwife, Fellow of the American College of Nurse-Midwives, Fellow of the American Academy of Nursing, and our President here at Frontier Nursing University. Sue is also the President-elect of the American College of Nurse-Midwives. Sue has been working in the field of reproductive health care for women for over 30 years. She's an early graduate of Frontier Nursing University's Distance Education Midwifery program and practiced full-scope midwifery care for several years. Believing that having more nurse midwives would ultimately serve the goal of improved healthcare outcomes for women, she shifted her focus to the education of nurse midwives. She has served as president of FNU for the last 16 years. During this time, the university has grown from 200 students to the current enrollment of nearly 2,000 students. Dr. Stone continues in the role of FNU president with a goal of improving healthcare for families through increasing the number of well-prepared nurse midwives and nurse practitioners. Thank you so much, Dr. Stone.
Thank you, Dr. Houston. Thanks so much for that nice introduction. And so I'll just go ahead and let's get started. So first of all, I want to say to all of you, Happy Nurse Midwifery Week. This is a week to celebrate nursing midwifery practice and also the concept of midwifery-led care. And it is a time to celebrate our outcomes and also the time for us to really work hard to integrate midwifery into the U.S. healthcare system as a concept. We're always trying to walk away from that idea that when you say to somebody, I'm a midwife, and they say back to you, oh, you are a midwife? So we're trying hard to move forward to join the rest of the world where midwifery-led care is a reality in most of our nation instead of a very small portion. So what I want to talk to you today in particular about is some of the characteristics of our healthcare system and the things that are going on in our healthcare system today that are causing some really poor outcomes. So I'm going to talk about maternity workforce shortages and what are the consequences of that and some of the possible solutions. So let's jump right in. So first of all, we know that we have a shortage of maternity care providers. There are fewer obstetricians, actually about the same number of obstetricians, but when you look at the number of women, the ratio of number of obstetricians to number of women is much less than it was even 20 years ago. So that is one concern. Family physicians who in the past, as recently as the year 2000, about 25% of them would provide maternity care. And a more recent study, I think 2014, showed only about 10% of them providing maternity care. So quite a drastic reduction in the number of family physicians actually providing maternity care. And of course, certified nurse midwives, certified midwives, I'll talk about those numbers a little later. But basically, we do know that there are not enough CNMs and CMs to fill that gap that is opening in the maternity care system. At the same time, we are seeing an increase in the number of babies being born. For example, we saw 3.74 million in 1970 and 4 million in 2014. And the Census Bureau, based on a number of births and immigration into our country, projects that that number will increase quite dramatically over the next 20 years. So yes, we have an off-balance picture there. When we dig down a little deeper and look at the rural areas of our country, those are some of the areas that are most affected. Of course, rural and underserved, but in the rural areas, as many of you know, we are seeing accelerated rate of hospital closures. A lot of small community hospitals are just shutting their doors, making families travel much farther to receive care. And then some of the hospitals are remaining open, but they are discontinuing their maternity care services. So that's a big problem. We know that a recent report from American College of Obstetricians and Gynecologists reported that 49% of all counties in the U.S. do not have an obstetrician gynecologist. Further, we know that only about 7% of obstetricians work in rural areas, while about 23% of our women live in those rural areas. So another discordant number that is causing disparities. And also, as we all know, the health insurance coverage is not a guarantee here in our country and can also always be a big concern. So what happens with this? This leads to difficulties. This picture that we're seeing leads to many difficulties with access to care, and we are seeing worsening healthcare outcomes overall. The maternal mortality ratio is an indicator of the health of a nation. It's also of biggest concern to us as midwives. U.S. has experienced a continued increase in the maternal mortality ratio since 1987, actually, when we had about 7.8 per 100,000. And 2013 numbers showed 21 per 100,000, and 2014, 22 per 100,000 live births. So you're starting to see this number just continue to climb, which is of such big concern. We should not be seeing this in a country that spends more on healthcare than any other developed nation. We are seeing roughly 900 women die each year in the United States related to pregnancy, during the pregnancy and postpartum period. And as I said, the United States has the highest maternal mortality ratio of any high resource country in the world. This is the shameful facts of it too, just looking at these numbers, and these numbers, this is a 2007 study, but these numbers are not getting any better. And we can see that non-Hispanic Black women die about 3 times more, and some studies show even 4 times more than non-Hispanic white women. And of course, this is seen across our whole nation. But one example I saw in some of the studies I've read lately, Washington, D.C. has the highest maternal mortality ratio in our country. When you separate the white women from the Black women in Washington, D.C., the white women have the lowest maternal mortality ratio in the country. That kind of disparity just shows that we have a lot of issues going on around health equity, and we need to dig deep and try to solve some of these problems, because it's unconscionable what's going on out there. So we, as nurse midwives, we all know we are reaching for health equity. It's high on our agenda, both at Frontier Nursing University, at the American College of Nurse-Midwives, and of course, as a whole profession, we have an agenda to decrease these health disparities. So why do women die? The medical reasons include hemorrhage, pregnancy-related hypertensive disorders, infections, pulmonary embolism, and cardiovascular conditions. But we know that at least half of these deaths in the United States are preventable. We have shortages of providers and accessible facilities, which I'll talk about in a minute. We have financial, bureaucratic, transport, and language barriers that impact women's ability to attain culturally competent and sensitive health care. So this is a major, major concern, this lack of accessibility to healthcare, and I want to talk about that just a little bit more for a minute. What does it mean to have access to healthcare? Accessibility should be a social goal and a human right, accessibility to healthcare. And we often in this country describe accessibility as the number of miles or the geographic distance to a healthcare provider. You'll see this in the numbers that come out from the federal government and those kinds of things. But we as midwives know that social distance is just as important as geographic distance. So when we talk about social distance, it doesn't matter if a clinic is 1 mile down the road or half mile down the road, if other conditions around that clinic are not met. And some of these other conditions include the service availability. So do we have a good number of providers so women don't have to wait and wait and wait in a clinic? Are the locations accessible? Do they have after-hours clinics, meaning do they have evening clinics or hours that work for women? Saturday clinics, women are trying to work, raise families, and it's important that we have clinics that are available on their schedule, not on healthcare system schedule. Women would like consistency of healthcare providers, and they also want a variety of providers. So, you know, if you have a provider that's right down the road but does not know your culture or even speak your language, it really doesn't matter that that provider is just around the block from you. Women need the resources to be able to make the services available to them. And this is economic resources and informational resources. So knowing where the care is, knowing how to access the care. And the economic is not only insurance. We have to also, you know, just think about these rural hospitals closing, and now women may have to drive an hour to get to care. There may be childcare arrangements that need to be involved. There may be a car that needs to be had. And is there gas in the car? All of these things can impact whether that care is accessible. And then the appropriateness of the service is probably something we really need to work on, almost maybe more than anything. But, you know, appropriate gender, if a woman really does not want to see a male provider or a female provider, we should be able to provide those choices to women. Again, continuity of care, confidentiality, that's important, especially in rural areas. We know that it's that everybody knows everybody else's business, but we have to be able to provide confidential care and quality care. And of course, again, cultural sensitivity. It is really an agenda of the college, both Frontier Nursing University and the American College of Nurse-Midwives, to increase the diversity of the healthcare workforce. We know that oftentimes women will want to have a race concordant care provider, someone who looks like her, talks like her, understands her deeply. And so by having a more diverse maternity workforce, we will be able to meet women's needs in a better way. So what's the plan? What are the solutions here? Well, the bright side is we have an increasing number of midwives, and we know that midwives can improve access to maternity care and primary care for women, rural women. AMCB, or the American Midwifery Certification Board, just reported the highest ever number of CNMs at 11,600. So our profession is growing, and we're very happy to see that. We have to have more midwives integrated into the healthcare system. So why? Let's look at midwifery-led care. There's many studies out there, but this is a Cochrane review published, I think, of 13 studies that looked at the outcomes of care of midwives. And there you have them. Less regional anesthesia, fewer episiotomies, fewer instrumental births, more spontaneous vaginal births, more continuity of care, fewer preterm births, less fetal loss before 24 weeks, higher maternal satisfaction, and a trend toward the cost-saving effect of midwifery-led continuity of care. So these are all great outcomes. We know that these outcomes can save women's lives and can improve both mortality and morbidity. So this is this issue of incorporating more midwives is real, and we need to work towards that goal. We also need to have a larger focus on primary and preventive care. We know that in the United States, you can have a heart transplant. It's fantastic that if our hip wears out, we can have a hip replacement, a knee replacement, and all kinds of high-tech care. And we are very, very grateful for that. But in this country, we just do not put the emphasis on primary and preventive care, and we do need to have more emphasis. And of course, nurse midwives and nurse practitioners are both very good at providing primary and preventive care. We must identify the reasons for our poor outcomes and develop programs to address these. Although I did state some of the medical causes of maternal mortality, it's hard to get a grasp of why the maternal mortality rate is increasing across our country, because we do not collect the data and do a deep analysis of what's happening with every single woman. This can make a big difference when you're making data-driven decisions in finding out what is happening so that we can develop the programs that will make changes. An example is California, which has done this for the past several years, really done a root cause analysis of every single maternal death, and they have been able to develop programs to improve that situation. And their maternal mortality rate now is one of the least in the country. So these kinds of things are really important to sit on on mortality review committees and really know what's going on state by state. We know that Texas has one of the highest maternal mortality rates in the country, but we don't really know why. And so studying the data is very much a needed avenue. We need to diversify the health provider workforce. We know that when there's race concordant care, we get better outcomes, and women are more likely to participate in the care, to attend the care, to understand what's being asked of them or what's being taught to them, and be a true participant in the care if they have someone who understands them and understands their culture. So I know I've said this twice, it bears saying twice. This is really important for us. Also, we need to work collaboratively. Although I did list some of the great outcomes of midwifery care, we know that we need to work collaboratively with our physician colleagues, our nutritionist colleagues, our pharmacy colleagues, our social work colleagues in order to create programs that are really going to make a difference for women and families. So collaborative care is extremely important as well. So what can you do as a midwife to make changes in these things? I would like to encourage you to be mindful about the issues that are going around you. What is going on in your practice at your place that bothers you, that you really think needs attention and help? Is there one change you can make in your care setting that can make a difference? Try to learn all that you can around these issues, and get involved. Be a servant leader. So think about, FACNM started the concept of National Midwifery Week many years ago. We are just starting out on National Midwifery Week this week. Their agenda is making strides for all women. And I would encourage you to join your professional organization, because this is where the policy people are trying to work on policies that will allow nurse midwives and midwives to practice to the fullest scope of their practice, and all kinds of support for midwives occurs here. Together, we're so much stronger than when we're trying to act alone. So as a midwife, you have to be a leader. Nobody comes into the midwifery profession because they want to have a more reasonable life schedule or make a ton of money. We come in because we want to make change. And in order to make change, you have to be a leader, you have to get involved, and you have to really know what's going on around you and participate in creating the solutions to this problem. So I just want you to think about this as you go through your week. This week, it is National Midwifery Week. Think about, what is your passion and what is it that you want to change? What can you change? What's bothering you that you know you could make a difference? How can you be the change that you want to see? I will encourage you to take a leap of faith and go out there and do something to really try to change this dismal picture in our healthcare system. Remember that you can do this. We all remember Mary Breckenridge. She had a dream and she made it happen. Being a midwife is more than just caring for women. You have to be a change agent. Look for the wrongs and work to make them right. and be an advocate for women and for families. So congratulations. Thank you for being a midwife or being a midwife student. I hope that you have a wonderful week celebrating that this week. And I hope that you are able to watch some of the many sessions we're going to have on our digital summit this week, geared to help you attain your goals as a midwife. So once again, happy Midwifery Week. Thank you for listening to this, and I'll see you in the other sessions of the virtual summit. Thank you.